Looking back, my orthodontic treatment was a memorable event in my life. I still managed to fit in all my usual activities while I had braces. Like most people, before I started treatment, I was unaware of what exactly was involved in having orthodontic treatment. So I'm going to tell you about my treatment so that you will have a better understanding of what may happen. At my very first appointment, my mother and I met the orthodontist. We discussed the reasons for wanting to have treatment, and then, so the orthodontist could make an accurate diagnosis and plan my treatment, certain things followed. These included having photos taken, x-rays. At the next appointment, my orthodontist had the x-rays and models of my teeth ready.
During the week, I examined your records closely to determine how orthodontic treatment can correct the position of your teeth. You will be required to wear braces for 2 years. Although it is sometimes necessary to have teeth extracted when having braces, in your case, this won't be required.
I was interested to know if I had to wear headgear. In my case, this was not necessary.
You should be happy about that.
Planning my future appointments took a bit of organisation, as we were not able to make all of them after school when it was most convenient for us. This is because this is the most popular time for people to come to the orthodontist. You may hear your orthodontist refer to your braces as brackets or bands.
Generally, brackets are the parts of the braces that are bonded to the front teeth, and bands are used for the back teeth.
My orthodontist informed me that even though my teeth were not sore immediately, they would be sore for the next few days. This is due to the braces starting to move the teeth with gentle pressure. I was advised that I could take some pain medication if the discomfort was too bad. At first, my mouth felt strange, and my orthodontist advised me that it would take a little while for me to get used to talking with the braces on. My lips and the insides of my cheeks also felt uncomfortable.
It will take a little while to get used to the new feeling, and you can put wax over parts of the braces that are hurting you.
Looking in the mirror, I realised that this is what I would look like for the next 2 years, and I was wondering what my friends would think. For the first few days, I found it easier to eat softer foods. An ulcer developed too, but this healed in a short time. Gradually, my braces became more comfortable to wear, but it took a bit of getting used to. My orthodontist informed me that I would need to be careful when eating, as I could damage my braces. I needed to cut my food into small pieces, especially things like apples, carrots, or hard, crusty bread rolls. This way, the braces are less likely to be damaged.
There are certain foods you shouldn't eat at all. These include sticky confectionery like toffees and hard muesli bars. These foods are likely to cause breakages to your braces and prolong your treatment. Acidic, fizzy and sports drinks are also best avoided. You should also restrict eating foods that have a high sugar content, or you could be left with marks on your teeth when your braces are taken off. It's better to eat foods that are high in sugar with your main meal, rather than snacking on these sorts of foods throughout the day. Other types of appliances may be needed in conjunction with braces. These include expansion devices, which are used to correct crossbites by expanding the upper teeth. Functional appliances may also be used to correct protruding teeth. These are similar to plates or retainers, however functional appliances are usually more bulky.
The orthodontist told me how to brush. You will need a soft toothbrush and move it back and forth in short strokes. Work your way systematically from one side of the mouth to the other. Make certain you brush all surfaces of all teeth. Spend enough time to make sure you clean your teeth properly, at least 3 to 4 minutes. Remember that a toothbrush cannot reach areas between the teeth, so for a proper cleaning you should also use dental floss. Flossing is more difficult when you have braces. You may find it necessary to insert the floss under the wire with a device called a floss threader, and then slide the floss gently between your teeth. Flossing can injure your gum if not done properly. Your orthodontist will show you the best way, so make sure you ask.
It's recommended to rinse with a mouthwash. Mouthwashes such as Savicol reduce plaque formation, while other types of mouthwashes contain fluoride. It's important to follow the instructions on the bottle, and the mouthwash shouldn't be swallowed. If your teeth are not kept free of plaque, the gums may become swollen and bleed. This can lead to gum disease, which can affect the result of your treatment.
I returned for my first adjustment appointment 4 weeks after my braces were fitted. I had to continue with regular adjustment appointments throughout the course of my orthodontic treatment. As part of my orthodontic treatment, I was also required to wear elastics. Elastics are sometimes needed to provide extra forces for the correction of your bite. I was instructed how to apply my elastics and was advised when I should be wearing them. It is very important to wear the elastics for the amount of time that your orthodontist advises. Otherwise, things will not improve as quickly. With my braces, I was still able to continue with all my usual activities, including playing contact sports. Mouth guards can be worn even with your braces on your teeth. The mouth guard will protect your teeth and also cushion your cheeks and lips from the braces. After 2 years and many regular adjustments, my braces were taken off. But this was not the end of the treatment. I needed to continue seeing my orthodontist, as retainers were the next step. There are different types of retainers. Some are like thin mouth guards, and others can be bonded to the teeth. The retainers are an important part of orthodontic treatment as they help to keep the teeth in their corrected positions. I learnt quite a bit about orthodontic treatment. Orthodontic treatment can be beneficial to adults as well as adolescents. Orthodontic treatment can improve a large number of problems. For example, teeth that are crowded, teeth that are too widely spaced, teeth that stick out. Other problems include open bite, where the front teeth don't meet, deep bite, where the top teeth cover the lower teeth, reverse bite, where the lower teeth protrude more than the top teeth. If you have any orthodontic treatment, the most important advice I can give you is to cooperate with your orthodontist. You will need to follow instructions, ask questions, keep appointments, and take good care of your teeth, gums, and the braces.